On the 11th of March 2020, the World Health Organization announced that the spread of the virus Covid-19 could be considered a pandemic. Measures were introduced in many countries that attempted to de-escalate the pandemic, including social distancing, quarantine, avoiding all but essential travel, and the closure of schools and universities. On the 20th of March 2020, in the UK, exams were cancelled and schools closed to all except the most vulnerable pupils and the children of key workers. This research set out to explore school staff experiences of the Covid-19 pandemic and understand the impact on staff wellbeing and mental health. 19 semi-structured interviews were carried out online, with a mix of school leaders, teachers and other staff from a range of UK school settings, including primary, secondary, special educational needs and alternative provision. Interviews lasted for an hour and verbatim transcripts were created for thematic analysis. Participants described having experienced a roller coaster of uncertainty and adaptation during the extensive and rapid change brought about by the pandemic, both in their personal and professional lives. Frustration was expressed in relation to the timing and communication of changing guidance and the public misconception that schools were fully closed, as staff attempted to juggle their personal and professional commitments. Staff in this sample had experienced loss, both in terms of a bereavement or more broadly in terms of mistransitions, endings, or the loss of face-to-face interaction with family, colleagues and pupils. Negative emotions including stress, anger, sadness, guilt, shock and fear were reported, sometimes being masked in order to buffer stress for others. In addition, a lack of sleep, loss of appetite, and inability to concentrate, strained personal relationships, or poor physical health were attributed to stress. In spite of these difficulties, some staff highlighted positives associated with change during the pandemic, including more time spent with loved ones, increased professional learning, and prioritising physical and emotional well-being. A range of protective factors helped staff to buffer against adversity and navigate the challenges they faced. These included a strong sense of purpose, collegial support, establishing boundaries and routines, and reframing the pandemic as an opportunity to learn or reflect. School staff wellbeing was a concern before the global pandemic, but this data strongly suggests that some adversity staff face has been exacerbated and that staff wellbeing is an urgent school and policy priority. Staff experiences during the pandemic could help better understand the factors that support staff wellbeing in the future. Opportunities for self-care need to be balanced with developing a culture of support that values all staff. Building resilience across the school community will be key. Increased consultation at both school and policy level would help to know how to best support staff and help buffer them for ongoing and future adversity. Capitalising on the opportunity to reflect may be challenging given the ongoing impact and uncertainty of Covid-19, but creating the space and time to harness learning from a time of crisis could lead to meaningful and transformative change.